Travel-related COVID-19 cases prompt health officials to urge testing for travelers returning to state. 4 Minnesotans have been infected with the P1 variant after staying at the Grand at Moon Palace in Cancun. The CDC urges no Mexico travel due to high COVID-19 transmission. As health officials continue to report more cases of travelers becoming infected with COVID-19 variants, the Minnesota Department of Health is urging people returning to Minnesota after travel, especially from international travel, to self-quarantine and get tested for COVID-19 before resuming activity in the community. The latest example of COVID-19 variants coming home with Minnesotans after travel involves a series of 4 cases of the P1 variant first detected in Brazil. 4 Minnesotans tested positive for the P1 variant after staying at the Grand at Moon Palace in Cancun between March 12th and March 23rd. The cases were in members of different families. The cases underscore the risk of travel during a pandemic, and in particular, the risk of traveling to places like Mexico, where COVID-19 is circulating widely. In fact, on April 2nd, the CDC issued a Level 4 travel advisory urging Americans to avoid all travel to Mexico due to the very high level of transmission of COVID-19 in that country. MDH Deputy State Epidemiologist Dr. Richard Danila has stated, "We know Mexico tends to be a popular getaway destination for Minnesotans in late winter and spring, and there may have been a considerable amount of travel to that country over the last few weeks." The recent CDC travel warning shows that Mexico is a very high-risk destination right now. So people should reconsider postponing any non-essential travel if you have not yet been vaccinated. Anyone who has traveled internationally is recommended to test 3 to 5 days after return from their travel, even if they are vaccinated, and to be on the lookout for symptoms. If someone has not yet been vaccinated, they should quarantine after return in addition to getting tested. We ask Minnesotans to do this to protect their families and the communities. All travelers should wear a mask, physically distance, avoid crowds, and wash their hands frequently. Unvaccinated travelers should test 1 to 3 days prior to leaving, and do not travel if you are sick or exposed to someone with COVID-19.